I'm not going to take away anybody's vaccines. I've never been anti-vaccine. I'm going to make sure the scientific safety studies and efficacies are out there and people can make individual assessments about whether that product is going to be good for them.
In a bold move that's sending tidal waves throughout Washington's political waters, Robert F. Kennedy Jr. has unveiled an ambitious vision to transform America's health landscape. As President-elect Donald Trump's choice to lead the Department of Health and Human Services, Kennedy's Make America Healthy Again initiative represents one of the most comprehensive health reform proposals in recent memory. Join us as we explore the 4 pillars of his controversial health revolution. Restructuring federal health agencies. The marble halls of Capitol Hill have become a stage for what might be the most dramatic reformation of America's health institutions in decades. As RFK Jr. makes his rounds through the Senate offices, his vision for restructuring federal health agencies emerges as a blueprint for institutional transformation that extends far beyond conventional reform. At the core of Kennedy's strategy lies a fundamental shift in how health agencies operate. Rather than maintaining the traditional emphasis on medical expertise alone, his approach prioritizes what he describes as institutional integrity. The plan involves a comprehensive overhaul of staffing across the Department of Health and Human Services, targeting what Kennedy perceives as deeply entrenched relationships between agency officials and industry interests. The scope of the transformation becomes apparent in Kennedy's approach to agency funding structures. Currently, the FDA receives approximately $3 billion in user fees from pharmaceutical companies for drug approval processes. Kennedy's plan challenges this financial relationship, arguing that it creates inherent conflicts of interest in the drug approval process. But this bold stance raises critical questions about alternative funding sources and the potential impact on drug development timelines. Within the CDC and other health agencies, Kennedy envisions a return to what he calls gold standard evidence-based science. This involves establishing new protocols for research validation and data transparency, particularly in areas of public health policy. The proposed changes extend to the agency's advisory committees, with plans to restructure how external experts are selected and vetted for potential conflicts of interest. Perhaps most significantly, Kennedy's reform agenda includes the creation of new oversight mechanisms within these agencies. These would focus on monitoring industry influence in research funding, policy development, and public health recommendation. The plan also calls for enhanced transparency in agency decision-making processes with increased public access to the scientific data underlying health policy decisions. The food revolution. In the heart of Kennedy's health transformation lies an ambitious plan to revolutionize America's food system. The revolutionary approach takes aim at everything from school cafeteria trays to vast agricultural operations across the nation's heartland. The foundation of the revolution stems from Kennedy's observation of stark differences between American and European food standards. His investigations revealed that over 1,000 ingredients commonly used in American food products are banned across European nations. This disparity became the catalyst for a comprehensive plan to overhaul food regulations in the U.S., targeting not just the ingredients themselves, but the entire system of food production and distribution. At the forefront of this transformation stands the school lunch program, where Kennedy envisions a complete reimagining of childhood nutrition. The plan calls for eliminating processed foods from federal food assistance programs, replacing them with nutrient-dense, whole food alternatives. The agricultural sector faces equally dramatic changes under Kennedy's vision. His plan challenges the widespread use of glyphosate and other chemical pesticides in farming practices, drawing attention to their potential health impacts. The proposal includes incentives for farmers to transition to more sustainable and organic farming methods, coupled with support systems to ensure these changes don't devastate agricultural communities. Perhaps most ambitious is Kennedy's proposal to integrate food policy with healthcare coverage. The plan suggests expanding Medicare and Medicaid to cover nutrient-rich foods as preventative medicine, fundamentally altering how the healthcare system approaches nutrition. Behind these sweeping changes lies a strategy to address what Kennedy identifies as a national crisis of chronic illness. By targeting food quality at its source, from production methods to distribution systems, the plan aims to create a comprehensive solution to America's mounting health challenges. Pharmaceutical industry reform.
If you look at the clinical trial studies, the actual studies that were done that were released of the Pfizer vaccine, Moderna has not released it. If you look at the Pfizer vaccine, there were 22,000 people in the placebo group, 22,000 people who got the actual vaccine. And the people who got the vaccine had a 23% higher death rate from all causes at the end of that study.
But that could not be the disease itself?
Within the sprawling landscape of Kennedy's health initiative, his approach to pharmaceutical reform emerges as perhaps the most contentious battleground. The proposed overhaul threatens to reshape decades-old relationships between drug manufacturers, regulatory agencies, and the American public. At the core of Kennedy's pharmaceutical reform lies a bold challenge to the industry's marketing practices. The plan targets the ubiquitous presence of drug advertisements on television screens across America, suggesting their elimination would mark a return to an era when medical decisions stemmed primarily from doctor-patient relationships rather than consumer marketing. This proposed change alone would redirect billions in advertising dollars and fundamentally alter how Americans learn about prescription medications. The reform extends deep into the drug approval process itself, with Kennedy taking aim at the Prescription Drug User Fee Act. This decades-old legislation, which allows pharmaceutical companies to pay fees to expedite drug reviews, faces intense scrutiny under the new plan. The proposed changes would restructure how drugs receive approval, potentially extending review timelines, but promising enhanced safety protocols and more rigorous testing requirements. Kennedy's vision encompasses a broader perspective on medical treatment options, advocating for increased research into alternative therapies and natural remedies. Perhaps the most controversial is Kennedy's stance on vaccine policies, where he advocates for maintaining access while emphasizing the importance of informed decision-making. The proposal calls for enhanced transparency in vaccine safety studies and the creation of more robust adverse event reporting systems, all while walking a delicate line between public health requirements and personal medical choices.
Mr. Chairman, about your meeting with RFK Jr. yesterday, do you have any concerns about his vaccine skepticism?
I don't discuss
not
my
the meeting,
private
but
conversation.
do you have any concerns about his vaccine skepticism?
Until I know exactly what, I mean, you got to tell me what it is.
I mean, he suggested that vaccines could be linked to childhood autism.
I guess I don't respond to people. I don't respond to quotes that other people have said until I verify them. And so I'm not going to make a comment on that.
But you're supporting him, is that right?
Yeah, I do support it.
The reform package includes sophisticated mechanisms for enhancing drug safety monitoring, with proposals for independent review boards and expanded post-market surveillance systems. The MAHA Coalition. In the evolving landscape of American healthcare reform, the Make America Healthy Again MAHA Coalition emerges as Kennedy's most innovative political creation. The unprecedented alliance brings together an unlikely assemblage of healthcare professionals, environmental advocates, natural health practitioners, and public policy experts, forming what might become the most influential health policy coalition in recent American history. Within MAHA's framework, specialized working groups focus on distinct aspects of health reform. The Environmental Health Task Force examines connections between environmental toxins and chronic diseases, while the Food Policy Committee develops strategies for improving national nutrition standards. Now it's time to hear from you. Do you think these reforms from RFK Jr. will be successful? Let us know your thoughts in the comment section below.